I told you. All right, and you know we're behind. We're so behind. But we're going to take questions. So if you have a question, please go to the microphone.
My name is Corey Franks. And I guess my question is for the stigma is when are we going to get rid of the stigma for the African-American heterosexual male? Right? We are only identified as an intravenous drug user. Right? That's how we identify. It's a stigma. I am a person, a heterosexual male who has been positive for 25 years. I did inject drugs, but I am a heterosexual African-American male who is only identified as an intravenous drug user. All heterosexual men who are HIV positive are not intravenous drug users. When are we going to let that stigma go? I'm sure that our African-American women who are out there are no interventions, none, for heterosexual males. And if we're in the business of stopping the spread of HIV to our heterosexual African-American women, they need to produce some interventions specifically for heterosexual African-American men.
Go ahead. Yes, you can respond.
Does this work?
You don't need no mic.
Can you hear me now? I would like to suggest something that we ask frequently. You know, being raised by my dad with no mom present, that's probably him coming out in me. I think heterosexual men, black men, should do for heterosexual black men. I think that we need black men. I don't hear a lot of voices from heterosexual black men. They're not speaking. So since they're not speaking, nobody's listening to them. We are desperately in need of. So for example, we have Masons. We got frats. We have all of these male-specific organizations, both locally and nationally, including the NAACP, who have none of this on their agenda. And I propose that if we had more black heterosexual men focusing on their heterosexuality, talking about AIDS, not how they got it, but the fact that they're a black man, heterosexual, who cares about his wife, his daughter, his grandson, or whoever, we could get some of these legislators to move. But we don't hear from heterosexual black men because they're afraid they're going to be not identified as an IBDU, that they're going to be branded as homosexual. And so I would say look for, just like we look for pastors clue, who understand that they can't save souls if they don't save the life of the person sitting in the pew. We're looking for some straight black men who aren't afraid, who are secure in their sexual orientation, to partner up with us and guide us and tell us, how do we get to y'all?
Well, let me just, but let me go back to the NAACP. I will say that they have Ben Jealous, the straight black man who, as CEO and president, has stood up and he talks about HIV/AIDS. Okay, I don't know locally, but I know nationally as a national organization. And can you fix this mic?
If the nationals are doing it, the question for us is the local chapter doing it? And if you know that the NAACP at the national level has an initiative, and your local chapter of the NAACP is doing nothing, that's the question to ask them.
Good morning to the audience and the panel. My name is Moselle Brown. I'm a community health worker / social worker for Unity Healthcare. I work at the Department of Corrections in D.C. And what I'm finding, I've been there since January of this year. And what I find out is that they do trainings. I just did a training with DOC. They have a training every year, and I noticed that no one comes in and talks about HIV and stigma in the Department of Corrections. And it's a lot of stigma in the Department of Corrections, as you can imagine. You have inmates that refuse to go to the ID clinic because it's labeled ID clinic, infectious disease clinic. And when they hear infectious disease clinic, the first thing they think about is HIV. And my role as an educator too is to let them know that just because it's labeled infectious disease clinic, it doesn't treat only the infectious disease clinic. Had the same situation with local clinics that treat people with HIV. First thing they hear, ID, HIV. And that's one of the problems that keep people out of care. Labeling other clinic and labeling from other people within those clinics. And this has been going on too long, and it has to stop. Because I'm going to say this, I'm going to let it go. What stigma does with anybody with any issue is that it kills people. That's why we don't have the retention that we have, because people are staying out of care just because they're being labeled.
They're right in the state of Maryland. State of Maryland, 6 years ago, I brought 5 of my staff to Maryland. Maryland has a program called Pharaoh, and I saw Michael Joyner back there somewhere. Hi, Mr. Joyner. Mr. Joyner funds a program in our agency called Pharaoh. It targets HIV positive, we target HIV positive inmates, and now that South Carolina has finally decided to desegregate, now we will have both negative and positive men in an 8-week intervention. Our goal is not just to make them aware of HIV. What Pharaoh looks at, and this came out of Maryland, they're doing it right now with Pharaoh. It looks at personal responsibility. And what is it to be a formerly incarcerated man who's coming out of the prison system, and what is his obligation now to himself and to his community? And so I would suggest that if you call the Maryland Department of Health, find out about the Pharaoh intervention, get in one of their trainings, and then set about setting some strategic plan to integrate Pharaoh into the system that you're working with, as we have done for the past 6 years now. It would help you, and it would most certainly help those men who are moving out of that system of incarceration into the general community. And I will be happy to give you any information I have, and I have a trainer, a TOT trainer on my staff.
I think in addition, the federal government funds through Ryan White AIDS Education Training Centers. There are 11 throughout the United States, and it's free, the training. So if you wanted all of the clinicians and the prison Department of Corrections, you can call me and we can make that happen. And those are AIDS Education Training Centers that have been funded for over 20 years throughout the United States that are free. This is your tax dollars, and all of you need to access. If you think that your healthcare providers need education and you want that done, please contact me so we can get you connected. You can go on the HRSA website. We have a map. You just go into and see where your area is, and they'll give you the AIDS Education and Training Center information.
Oh, I think that mic works. Did he hit it? Okay, no. So, okay. There you go.
Okay. My name is Moises Agosto, and I have a question about, we know that the highest rate of infection happen among African American